Equally important in our battle against COVID-19 is our work to expand hospital capacity in preparation for our peak. In addition to working with hospitals to add beds at existing healthcare centers, as a reminder, we are in process of standing up alternate care facilities at 5 sites across the state: McCormick Place in Chicago, Advocate Sherman Hospital campus in Elgin, the Metro South Health Center in Blue Island, Westlake Hospital in Cook County's Melrose Park, and Vibra Hospital in Springfield. But remember, those beds aren't healthcare sufficient beds until they have doctors and nurses to care. And I'm proud that in our workforce expansion effort in healthcare, we have now surpassed 2,300 applications for temporary permits for out-of-state and former medical professionals to join our fight against COVID-19 here in Illinois. And finally, to round out our conversation about hospital capacity, I must talk about ventilators, the equipment known to make a real difference in the outcomes for COVID patients who are in critical condition. First and foremost, I want to express my gratitude, my genuine, sincere gratitude, to the people of California and to the governor of California, Gavin Newsom, who sent us 100 ventilators overnight for use by patients here in Illinois. It is truly incredible to work with elected officials across the nation who are providing true leadership. My pledge to the state of California and to every other state and territory is that when we can, once we are past our peak, Illinois will pay it forward. We will pay it forward in any way that we can, including passing along these ventilators to the next hotspot in the nation and any that we may be able to spare. As you know, over time, we've also received 600 ventilators from the federal government, 300 of which were directed specifically to the city of Chicago by the White House. I'm grateful for all of those vents as well. Scour the globe with our own state-level procurement operation to secure the rest of the ventilators that we may need. While this market is just as competitive, if not more so, than that for PPE, we have so far placed orders for 620 ventilators. The first batch of these deliveries will arrive in April, with the rest coming over the next several months. Ventilators are critical tools in this fight. They can save lives, but they are not a cure. No magic quantity of ventilators will solve COVID-19 for us. No number of ventilators will make up for a person ignoring our stay-at-home order or not making their due diligence, taking their due diligence in washing their hands and the other orders that we've asked you to follow. Ventilators are but one part of what amounts to a many-pronged approach, but all of them are phenomenally critical altogether. Staying at home is the most likely reason that you can avoid ending up on a ventilator. Remember that. Staying at home is the most likely reason that you can avoid ending up on a ventilator. I know that especially on a warm day like today, that's particularly hard to hear. The sun shines and it feels a little bit more like this should be over, that you have time to hang out with your friends and loved ones by the lake, at the fairgrounds, over dinner. Believe me, I too would do just about anything for an immediate solution to this. Here's what you need to know, though. That solution isn't coming tomorrow or next week or next month, but it is coming. Every day that we support our healthcare systems, every day that we flatten the curve, that's another day that the incredible roster of scientists and researchers and innovators in the world come a little bit closer to finding solutions in the fight against COVID-19. A vaccine, yes, but also treatments, therapeutics, widespread antibody tests so that we know who out there has already had the virus and recovered. Just yesterday, a second company launched the first human trials for a vaccine. By bending the curve, we are buying them all time. But a vaccine will not come in the next few weeks or even the next several months. We need time to find solutions, time to save lives, valuable time now that allows us to move beyond the crisis more quickly. I want to thank the many, many Illinoisans who are staying home and by doing so protecting their communities and their families, their neighbors and their friends. They are all in for Illinois. And with that, I'd like to turn it over to Dr. Ezike.
Thank you so much, Governor. Good afternoon. As you all are aware, it's very difficult to share the information about the lives lost and all the additional individuals who have contracted this disease. But it's important for everyone to remain informed, and it is important for us to have a realistic picture of some of the dangers associated with COVID-19. We are reporting 1,287 new cases, including 73 individuals who have lost their fight against COVID-19. That brings our statewide total to 13,549 total cases with 380 lives lost. While we know that our healthcare system is gearing up and preparing for this pandemic, we're getting more PPE, we're acquiring ventilators, and recruiting healthcare workers. Let me give you some positive news. We repeated our survey to identify individuals who have recovered post-receiving a positive test. We received approximately a 40% response rate, which is good as these electronic surveys go. And of all the people who responded, who are 7 days after their positive test result, 43% indicated that they have recovered. Given the large number of cases, we know that that's a significant number of people to have been in an improved status just 7 days after their positive test. So while 68% of the cases in Illinois are younger than 50, we do know that 80% of the deaths in Illinois have occurred in those who are 60 years and older. But we have seen deaths in all ages. Yes, we are reaffirming that our older population is at highest risk, but as all people can be infected, that means that all people are at risk, and even for the most severe complications, including death. The more people that are infected, the more additional people that this virus can be spread to. And with an eye on our most vulnerable populations, again, these high-risk groups are elderly people, people in congregate settings like in nursing homes and congregate living facilities, people who have hypertension, people who are on hemodialysis, who have liver disease, people who are battling cancer or who are otherwise immunocompromised, people with cardiac disease, chronic obstructive pulmonary disease. And pregnant people are in this category as well. I say this not to cause despair, but to arm everyone with the truth, as well as with the weapons that we have. In normal battle, you show up to the fight, but for this battle, the winning strategy is to stay at home. It's to retreat, it's to be in the house, wash your hands frequently, cover your face, your mouth and your nose, keep 6 feet of distance if you have to go out. We want to turn this tide and end the pandemic as soon as possible. And with that, I will summarize comments in Spanish. Buenas tardes. Nunca es fácil compartir información sobre las vidas perdidas y las personas que han contraído COVID-19. Compartimos estos datos no solo para mantener a todos informados, pero para ayudar a pintar una imagen de los peligros de COVID-19. Hoy reportamos 73 vidas adicionales perdidas para un total de 380 en Illinois. También estamos reportando 1,287 casos para un total de 13,549. Sabemos que nuestro sistema de atención médica está trabajando duro durante esta pandemia y estamos trabajando para obtener más PPE, más ventiladores y más trabajadores de la salud. Pero hay buenas noticias. IDPH ha estado enviando encuestas a personas que fueran positivos para COVID-19, preguntando sobre su recuperación. De los que respondieron, aproximadamente el 43% indicaron que habían recuperado, lo que significa es que ya no tienen síntomas de COVID-19. El 68% de los casos en Illinois son menores de 50 años, pero el 80% de las muertes en Illinois ocurrieron en los mayores de 60 años. Pero tenemos muertos en personas más jóvenes también. Nuestra población mayor está sufriendo más graves, pero también muestra que personas de todas las edades están infectados con este virus. Quiero asegurar a la gente de Illinois que estamos trabajando por la salud y la seguridad de todas las personas en el estado, todas las razas, etnias, géneros y edades. Pero hasta que haya una vacuna, todos debemos continuar en casa, lavarnos las manos, cubrimos la cara y mantener una distancia de 6 pies entre las personas para que podamos cambiar el curso y poner fin a esta pandemia antes. Hay que seguir luchando. And with that, I will turn it over to Governor Pritzker.
Thank you. Happy to take any questions that you may have. Yes, sir.
Yeah, Governor, the staff member that you said that tested positive, did this individual have close contact with you or Dr. Ezike? Were you tested? Was the doctor tested?
I was not tested. I did not have regular close contact with this person. This is somebody who worked in the office, but not particularly close to my office, and didn't regularly enter my office. So very little direct contact with this person.
And Dr. Ezike as well?
Yeah, I think that
It's
Same
the same.
situation.
And again, remember that testing typically would come after the symptoms developed, but was not tested either.
And just a question regarding the report of the state's procurement of cadaver bags. Did you want to, if you could comment on that, is 12,000 the number that the state is seeking, and is that a number that is within the models of something that could be in the plan?
I don't really want to comment on it. I mean, we're preparing in all ways. We don't know what the numbers will be in the end, and it's hard to point at something that would tell you exactly what those numbers would be. I mean, obviously there are models out there, but a lot of them. But we want to make sure that we're prepared. If we end up being over-prepared in that way, I would be glad that we were.
Governor, we heard from the CDC today that the current data on deaths are underestimates, and you addressed that. Is there any way to calculate how many deaths we may have missed here in Illinois that could be COVID-19 related?
Is there any way to calculate?
How many deaths may, or estimate how many deaths may have occurred since perhaps January?
That are unrecorded?
Unrecorded.
So the question, I'm not sure if everybody can hear online or elsewhere, was, is there any way to estimate how many people may have died of COVID-19 that were unrecorded because we weren't counting at the time, or professionals didn't know? I think that the DPH is actually going back in the records to look at some of those, but I don't think that it's clear yet. Maybe I should turn it over to Dr. Ezike.
No, it's a good question. We do have, coroners and medical examiners who maybe might be doing postmortem tests to try to see if they can get at that information. So the numbers may increase for numbers of people who may have expired, who passed on before it was acknowledged that it was related or that they had COVID at the time of death.
And is there some protocol now in place that's requiring everybody to be tested for COVID-19, even if there wasn't signs before they died?
Yeah, so there's not a protocol that's been put out by DPH, but I think people are taking the totality of the case and trying to decide who might be appropriate for testing and not. And so we might get some adjustment of our numbers, and we will update you with those numbers on our website and as we report out.
We'll do a couple more from the room, and then we got to go online.
Yes, sir, Ed.
Dr. Zike, you had
I
mentioned
think,
on
Ed, did you have a question? Yeah, yes, sir. You bet.
Do you want local law enforcement to enforce your stay-at-home order to the point of arresting citizens?
Look, I have not encouraged that. That is up to local law enforcement and to local entities. Cities and counties, some of them are looking at passing ordinances, for example, and some of them have declared their own states of emergency. There are situations like what I read about in Quincy where there were several parties, 2 parties that I'm aware of that occurred. And look, I think we're asking people to do the right thing. And most people, the vast majority of people are doing the right thing. But if people are encouraging others to get together in groups of more than 10 or to not socially distance, I mean, I think at some point it is worthy of considering a real consequence.
Okay, and then you mentioned sort of everyday citizens. I want to ask you about that. How about someone who's at their home, right, and they look next door and there's, something going, 50 people in the lawn? Do you encourage them to call local law enforcement?
I do. I would.
Thank you, sir.
We'll do one more question in the room.
You mentioned law enforcement. We've noticed state police out there that they don't seem to be pulling people over. Has there been some directive from your office to state police to conduct traffic enforcement differently? We've seen vehicles parked out in the middle of expressways, state police with their lights on, just there as a warning, trying to get people to slow down.
No, I have not given any directive like that.
Okay, we'll go to questions online. Hospital executives have told us they're prepared to share 1 ventilator with 2 patients. Is the state advising hospitals to do this? Wouldn't this effectively double the number of patients who could be treated by ventilators we do have?
So the process of allowing a ventilator to be used by 2 people is not one that should be encouraged. It is one that would be an extreme last resort. We are trying to obtain ventilators from every corner of the earth that we can so that there will be 1 ventilator available for someone who needs it, not 2 on 1 ventilator. So, that's what I would have us focus on. I mean, that would be some extreme circumstance. And frankly, I've heard that the use of 2 people on 1 ventilator is something that isn't even medically considered appropriate in any way, because the machinery of a ventilator doesn't allow for adjustment for 2 different people on 1 machine.
Do you have any regrets about anything you should have or shouldn't have done or said during this crisis?
Oh, gosh. I think that's always a hard question to ask somebody in public life. Are there more things you could have done, or could you have done something differently? I suppose so. Every day, I ask myself about each decision that I make. Is there another choice here? Or did I miss something? I can look back certainly and say, did I miss something that happened in the past? But look, we took action. We were quick, I think, to get on this subject when it was clear that just asking people to not gather in groups of 50 or 250. I think originally we said 250 and 1,000. 1,000 being enforceable, 250, that seems like months ago now, right? But that's really about 4 weeks ago, and that's back when, there were very few cases. That didn't seem like enough, so we went to limiting the numbers of people getting together to a smaller number, and then closing bars and restaurants, and then closing schools, and then the stay-at-home order, and so on. And yet there are more things that could be done. But, I wish I knew about this in January when the intelligence agencies seemed to know about it, and we could have begun building ventilators ourselves.
To counteract COVID's impact on minorities, you said the state is reopening hospitals in those communities. You are saying that they will only serve Black and brown patients, or are you reopening them for good? If not, how does it close the racial health gap?
No, we are not limiting it to a certain race. That's not the case. And people will be referred to those hospitals. I think the benefit, for the most part, will be that people don't show up as a matter of first resort to any of these alternate care facilities. They are referred to those facilities. And if it is near where someone lives, that will be a better place for them than some other location. And so it's really just a reference to the idea that we'll be able to serve more people, and many of the people who will go to those facilities will be perhaps closer to where they live.
How do you respond to Rep. Blaine Wilhauer's suggestion that the longer we're quarantined, the more we delay herd immunity, which could ultimately lead to more people getting the virus?
Okay. Folks, let me just point out that Great Britain went by this theory, that perhaps if we just let everybody get it, then everybody will have herd immunity faster, and everybody will be okay. Well, guess what? If you let everybody have it all at once, which is what happens when you just let it go, you overwhelm your healthcare system, and more people die. A lot of people can die. And so the suggestion that we should just let it happen so that the herd immunity occurs faster is an invitation for us to just let people die. And I won't do that. I will not do that.
Can you provide more detail on the federal medical staff that is being sent to Illinois? How many people are being sent? Where are they being assigned, and what roles do they serve?
So we are awaiting the final approval. We were told yesterday that we had approval to receive these medical staff. We're still awaiting final approval of them. They are intended to, as I now understand, to be assigned to we had field medical stations, those 250 bed packages that arrived for McCormick Place. Those personnel are intended, as I now understand, to staff McCormick Place and those locations. But there's no reason that we can't, if they are in fact assigned, and I assume they will be, there's no reason why we can't go back to the military and to the federal government and ask that we reassign some if that's appropriate.
In terms of opening the state back up on May 1st, if you extend the stay-at-home order, would you consider opening up parts of Illinois, especially some counties that haven't been severely affected by COVID-19?
Would I consider opening certain parts of Illinois? I mean, look, we're at 77 counties as of today where there are cases, and it's growing. And the number of cases is growing, and the number of deaths is growing now. And so it's hard for me to see that just because you haven't had a case in your county or in your community, that you're not going to see cases developing and growing. And we see hotspots, correct, that are happening all over the state. Look at, areas like Champaign and like Metro East. And we need to get much further along here before we start talking about a regional or a statewide stand down of these orders.
Governor Pritzker, President Trump said in a press conference last night you were very happy about the White House COVID-19 task force response to Illinois' needs. The president cited a governor's meeting with Vice President Pence on Monday morning and said, quote, "There wasn't a negative person on the call. Even Governor Pritzker from Illinois is happy." He suggested that on one hand, you're positive about the government's work on the phone, but telling the press a different story. Could you respond to that?
The president's taking one snapshot. What I was happy about on that call was the fact that the Army Corps of Engineers had done such a spectacular job working with our local tradesmen to build out McCormick Place. And I expressed my gratitude for the help of FEMA in a variety of circumstances. But I have been on many calls with the White House, with staff at the White House, with the Vice President, even with the President, and I have expressed my displeasure on a number of those calls. Look, I'm happy when they make promises and then deliver upon those promises. I am unhappy when they do not deliver on promises or when lies are spoken. Look, I'm going to fight for the people of Illinois in every and all circumstances, but I'll praise somebody when they do something right.
Regarding IDOC furloughs, will any inmates, regardless of crime, be eligible for this furlough if medically vulnerable? Where will they go when released? And how will IDOC ensure they don't spread COVID into their communities?
Well, everybody that's released has a medical review before they're released. That's the first thing. Second, no, we're not. This is not open to anybody and everybody that's incarcerated in the state of Illinois. We have reviewed files, continue to review files of those who are nonviolent offenders, those who are pose the least risk to communities, and we have been working expeditiously as possible to make those reviews. There are some limitations on our ability, even for somebody who is at low risk, or at least low risk in their community, to returning to their community and committing a crime, because we are required to have a location for them to live at. And sometimes they don't have some place to go. But we're trying to work through even that problem by working with local organizations. So we'll continue to work at this. I'm giving you kind of regular updates here about how we're managing through with our corrections. And I think that our corrections staff and leadership are doing an excellent job.
This will be our last question. When will workers in the gig economy be able to apply for unemployment insurance on the state's IDES website?
Yep. So there are independent contractors who are eligible, have the ability to get unemployment even now under what the federal government offered in its last relief package. So I'm working with our federal officials to try to continue to expand that opportunity for people. Look, there's a lot of relief that's going to be needed here, and we can't stop now. And fortunately, we have two great warriors in the U.S. Senate and our House members who are all fighting for the same thing, fighting for the state of Illinois. And I'm working together with them. I had 2 calls last night with 2 different members of our congressional delegation exactly about how to expand relief for people across Illinois. I'll continue to do it. Thank you very much.
Thanks for watching, and if you haven't already, please consider subscribing to our channel. And while you're at it, please leave us a comment. Thank you for watching.